Thank you, Chrissy. Today, we are announcing one new case of COVID-19. The new case is in Central Zone and is related to travel outside of Atlantic Canada. There are 11 active cases in our province. Thank you to everyone for continuing to follow the protocols and keeping the case numbers down. We are watching what is going on across the country and in one of our sister provinces close to home. It doesn't take long for COVID-19 to spread, and knowing that there are cases of COVID variants across the border in New Brunswick, we have to remain vigilant and humble. And as the vaccine continues to roll out, we've administered more than 16,000 doses, and just over 3,500 people are now fully vaccinated. The second dose does take time because we have to wait 3 weeks between our shots, but now that time has passed and those numbers will start to climb at a more regular basis. But I'm really pleased to say that every Nova Scotian that has received a first shot will get their second dose. We want to see those first shot numbers climb as well, but all of that will depend on supply. We're continuing to vaccination in our long-term care residents, but we also know older Nova Scotians living at home need protection too. That's why we're pleased to share with you that the first community clinic for Nova Scotians age 80 and above will take place on February 22nd in Halifax. I want to thank everyone involved in our vaccination program, to those behind the scenes organizing the rollout, and of course all the doctors, nurses and volunteers helping to administer the shots. And I want to thank all of you for your continued patience as we find our way through this pandemic. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Before I start, I just want to recognize a young girl who lives here in Halifax, Peyton Diggs. She works with the Autism Arts program. She made me, she did the design of the tie I'm wearing today, and she worked with Autism Nova Scotia, who turned it into an actual tie. So thank you, Peyton. I look forward to seeing your first art show, and thanks to Autism Nova Scotia. So as the Premier said, it has been a good week. Since our last press conference, we've seen cases range from 0 to 1 to 3 cases. This is good news. Your efforts continue to pay off. All we have to do, the proof is in the numbers. However, our situation could change quickly. We have to keep reminding ourselves of that. COVID-19 is still very much around us in other parts of Canada and the globe. We are also closely monitoring for the COVID-19 variant, which certainly appears to have a much higher risk of transmission. And we continue to adapt our vaccine rollout plan based on a supply that is still unpredictable. With our low case numbers, we unfortunately are seeing a decline in our asymptomatic testing. It seems like people feel as we have very low case numbers, we don't need to be so worried. That couldn't be further from the truth. We need people to continue to get tested. Our asymptomatic testing is a key part of how we have been able to achieve the safe level that we're at and how we will continue to stay in that place. It has been recognized across the country as on the cutting edge as part of our comprehensive approach to COVID-19. Testing helps stop COVID-19 before it has a chance to spread. And so we encourage all Nova Scotians to consider making COVID-19 testing part of their ongoing personal COVID protocol. And especially if you are someone with a high number of contacts, whether it's through the work that you do or in your social circles. You can go to the 811 website at any time to book an asymptomatic test through one of our primary assessment centers, or you can stop in at one of our rapid testing pop-up sites. I did that last Friday right at the convention center, and the schedule for those pop-up sites that were in communities around the province on a rotating basis, you can go to www.nshealth.ca/coronavirus testing. For this week's vaccine update, I will begin with a recap of our supply. Since December 15th, we have received almost 29,000 doses of COVID-19 vaccine. This has allowed us to administer almost 16,000 doses of vaccine. We did release our detailed vaccine report yesterday. I won't recite those, and I would encourage anybody who is interested in more detailed information and data to go to the coronavirus website. And although we didn't receive any vaccine last week, we are scheduled to receive 1,950 doses of Pfizer and 4,000 doses of Moderna later this week. And as we have with previous shipments, we will administer half as first doses and hold the other half back for second doses. Our low rates of COVID-19 activity continue to allow us to hold back these second doses so people can be fully immunized. We do not want to find ourselves in the position where vaccine supply delays may mean someone doesn't receive their second dose at the right time. Other provinces are ending up in this situation. We now have 10 cold storage sites up and running across the province. These sites will continue to feed our 8 healthcare worker clinics, and the clinics receive vaccine on a rotational basis until we get a more stable supply, and then where we can have all our clinics up and working at the same time. So this week we have healthcare clinics running in Halifax, Kentville, Yarmouth, and Sydney. We have 9 more long-term care clinics are coming or have or will come online this week to start administering first doses of vaccine to residents and designated caregivers. And long-term care facilities who have already completed their first doses of vaccine will start to get the second doses as early as February 11th. There continues to be a lot of interest in vaccine supply and how this will impact our ability to immunize Nova Scotians. And as I've mentioned before, we are prepared to ramp up or ramp down based on our vaccine supply. We continue to plan based on our anticipated vaccine supply that we will still on target to get Nova Scotians an opportunity to get immunized by the end of September. However, currently, due to our existing limited supply right now, we continue to offer vaccine to the following groups through healthcare or long-term care clinics. So those who work directly with patients in hospital or patients in their home, those who work and live in long-term care homes and their designated caregivers, those who work and live in Department of Community Service facilities like adult residential care centers, regional rehabilitation centers, and residential care facilities. And we are close to standing up prototype clinics for Nova Scotians who are over the age of 80, and I'll have more to say on this in just a minute. We also are continuing to work with our First Nations and African Nova Scotian communities right now to understand their needs, to ensure that our vaccination is culturally responsive, and we can have prototype clinics within the coming weeks for both those communities. When we get a secure and robust vaccine supply, we're anticipating that towards the end of April or May, we will be increasing the ways Nova Scotians can get their vaccine. 3 main models of delivery will include mass community clinics based on descending age groups, so starting with the oldest and moving downwards. This is how most Nova Scotians will get immunized. We know that age is the biggest risk factor for severe illness and death from COVID-19, and we have a responsibility to vaccinate those most at risk first. We know that in Canada, those age 60 plus account for 68% of hospital admissions, 64% of ICU admissions, and 96% of deaths. These facts are clear. An age-based approach is also faster. We can quickly identify how many Nova Scotians fall into each age category. We can better manage vaccine in clinics to meet anticipated demands. And all of this results in more Nova Scotians receiving their vaccine sooner. Our age-based approach will begin, as I said, with Nova Scotians 80 and older, and the next group will be 75 to 79, and we'll continue to work down the age groups in 5-year blocks until all Nova Scotians have had an opportunity to receive vaccine. Our second mainstream is going to be specific workplace clinics. So on top of the healthcare workers who we're immunizing now, anyone else who works in a hospital and may have direct contact with patients, community-based healthcare providers, including doctors, nurses, dentists, dental hygienists, and pharmacists and pharmacy technicians. These will continue our hospital-based occupational health clinics for these specific healthcare work groups. We'll also continue immunizing people who live in congregate or group living settings. So we'll move beyond the groups I've already described and move into any other group settings such as correctional facilities, shelters, and when we bring in temporary foreign workers for our agricultural sector, we'll make sure they are immunized as well. We're also working out the details on how we people who regularly travel in and out of the province for work, such as truck drivers and rotational workers, they are at an increased risk of introducing the virus, including the variant strains. So we want to make them, as soon as we can, make them a priority to vaccinate them. Doing that protects all the rest of us. We also have some specific work sites that are based on the nature of their work, large food processing plants, that they cannot maintain public health protocols while they're doing their work, and we need to protect those locations, because protecting them prevents an outbreak happening and spreading to the community. So some specific work sites that making them a priority protects all the rest of us. And we also are going to be focused on, as I mentioned earlier, African Nova Scotian communities, our First Nations communities, continue to make them a priority based on our experience with our prototype clinics. I know there will be some concerns from some occupational groups who are not specifically identified as a priority, but I want to assure them that the decisions we've made on sequencing for vaccine have been considered carefully and weighed many factors. And I want to emphasize that our goal is for all Nova Scotians to have an opportunity to get 2 doses of vaccine as quickly as possible. The way to do that is to focus mainly on age. So I ask everyone to support this process and come forward when it's your turn. This is once again about putting our collective health and well-being before our individual health and well-being. A little bit more about the community clinics. I'm pleased to announce that the first age-based community vaccination clinic, so this is for people 80 and above, will start February 22nd and run until February 25th at the IWK Health Center. We're only able to do a small number of people through this clinic. We're calling it our prototype, but we will learn from that, and then when we're able to have more of these clinics and sustain them, we'll have more effective, efficient clinics. This will be by invitation only. A random selection of Nova Scotians 80 and over who live within about an hour from the clinic site will receive a letter the week of February 8th. This letter will confirm their eligibility to receive the vaccine, and it will tell them how they can go to book their appointment. Again, this is for people who are only for people 80 and over and who have received the invitation will be eligible to actually book their appointment at this clinic. But so we ask people who don't get the invitation, be patient. We have a small amount of vaccine. We're doing this as a way to learn, so when everybody else can get the vaccine, we'll be as efficient and effective as we can be. So looking forward in the weeks to come, we plan to have a total of 10 community-based clinics operating between HRM, Truro, Cape Breton Regional Municipality, Kentville, Yarmouth, Antigonish, and Bridgewater. By early March, we plan to have our first healthcare provider-based clinics operating. These prototype clinics will be in pharmacies and physicians' offices. And our plan is to expand these clinics to more locations throughout April and May as our vaccine supply ramps up. As we stand up these community and provider clinics, these will be big milestones in our immunization efforts. And I want to thank our providers, particularly Doctors Nova Scotia and the Pharmacy Association of Nova Scotia, for stepping up and our ongoing work on how their members can support our vaccination plan. I also want to thank our dental and veterinarian colleagues who have also offered their expertise to help administer vaccine if and when that may be needed. Before closing, I want to mention that this past week, our compliance inspectors from Alcohol and Gaming, Labor and Advanced Education, and Nova Scotia Environment completed over 260 inspections across the province, covering a range of businesses. And I'm happy to report that compliance across all these sectors remains high. So I want to acknowledge and thank the businesses for their adaptability, flexibility, and cooperation with the public health orders. I know it's not easy. There's often financial strain, but what all these businesses are doing is directly contributing to our COVID response and helping keep Nova Scotians safe and healthy. We will be back on Friday with an update on restrictions, and until then, I ask people to continue to focus on we are in a good position, but a tenuous position. We have to maintain the course, continue to be slow and cautious, and stay COVID safe. So, Premier, I talked a lot about vaccines, talked a lot about antigens, antibodies. Do you know why ants don't get sick?
No.
Because they have little antibodies.
No wonder you guys have so much fun at public health. Over to you, Chrissy.
We'll take one question and one follow-up in the time that we have for today. First question will go to CTV Natasha Pace.
Thank you. Dr. Strang, I know you just talked about restrictions and how there will be an update on Friday, but we're wondering whether or not the province is considering lifting restaurant restrictions before Monday at midnight, so restaurants wanting to host Super Bowl events could stay longer?
I think.
No, we're not.
Go ahead with your follow-up, Natasha.
Okay. Also, Dr. Strang, you mentioned that dentists and veterinarians have offered their services to help with max vaccination clinics. Wondering whether or not you have given them any final word if they will be used, and whether or not you might use paramedics to deliver vaccine as well.
So right now we're working on getting a good, very good cooperation from as a Doctors Nova Scotia pharmacist. We're planning our immunization community clinics based on them, but we still have a lot more planning to do. So no final decisions yet on whether we will need to use paramedics, dentists, or veterinarians. But we really thank all those groups. We know where they're ready if we need them. We have a good process for based on information and materials from the Pharmacy Association that we can very rapidly train people from a healthcare background if they need to be trained to actually deliver a vaccine in a safe manner. And so if we need these groups, we can actually turn to them and stand them up very quickly.
Next question will go to CBC's Shayna Luck.
Good afternoon. My first question is for the Premier. Premier, the federal government has imposed travel restrictions for flights into Canada to prevent the spread of COVID variants. Moncton and Halifax are closed to international flights. The seafood and farming industries are concerned about how this will affect the arrival of temporary foreign workers. What's Nova Scotia's position on this? Would you like to see an exemption?
Well, anytime somebody comes into our country, whether, as you described, somebody coming here to go to work, we'll work with public health. I think it's pretty clear when they came in last summer, they had to isolate for the 14 days. They were monitored through that process. But I think whatever the steps that are taken, Dr. Strang and I will work on it from our end. But we would certainly, no one is going to be able to come in here with a free pass without following some level of guarantee that they are quarantined. But maybe Dr. Strang, you have something to add.
Yeah, we're certainly having ongoing discussions with the Department of Health and Wellness at my level with the Deputy Minister around understanding more of the details of the federal announcement. But we did, for even in Wave 1, and now as we were reopening of Wave 1, any temporary farm workers who came in, we had a process that they maintained the 14-day quarantine period. So I think the answer is we'll continue to work with the federal government this additional step of testing upon arrival. We've already had conversations in my team about how we use, as part of our increased vigilance around variant strains, how we might need to use testing as part of the quarantine process for the temporary foreign workers at the provincial level.
And as I said a couple of weeks ago, that if the federal government is allowing flights in, that quarantine should be taking place at the airport where they land or very near that airport where they land. As you rightly pointed out, there are no international flights coming into Atlantic Canada right now. They go through Toronto, Montreal, Calgary, and Vancouver. And it is our position that the quarantine should start at that point of entry.
Go ahead with your follow-up, Shayna.
Thank you. My second question is also for the Premier. Sebegin First Nation has filed a lawsuit over the rules that prevent the band from selling its moderate livelihood lobster catch. You were waiting for the federal government to sort some of this out, but your government could also be facing some expensive legal bills. Sebegin argues you could just change the regulations. What's your reaction to that?
We have a different point of view on this. As we've said all along, that buyer's license is related to the fishery that is described in the Federal Fisheries Act and laid out by the national government, and we believe that's where it is. But Sebegin wants to challenge that in court. We will respond.
Next question will go to John McPhee with the Herald.
Thank you. I'm just wondering for the prototype clinics planned this month for people over 80 years of age. I'm just wondering how many people do you expect will be involved in that clinic, the one that begins, I believe, in Halifax?
Yeah, I don't have the number off the top of my head. It's a few hundred. I think it may be in the range of 300 to 400 people, acknowledging we have limited vaccine supply that we have to, stretch in a number of different ways. We wanted to try at least start this clinic so we can actually learn from it and improve our model of other age-based kind of clinics and so we're as prepared as we can be when we get more robust vaccine supply.
Go ahead with your follow-up, John.
Thanks. Yeah, just to follow up on the point of these protocol clinics, what exactly is being tested here? The number of people that can be dealt with in one day, the type of settings, whether it's going to be in community centers, that kind of thing?
It's a number. We got people looking at locations, but when we do the prototype clinic at the IWK, it's everything from how smoothly does our registration process go. We need to identify people based on, through MSI, based on their date of birth. How do we get them an invitation to all the processes? How do we get people, especially elderly people, to the clinic, and how efficient is the clinic doing that? Like anything, the first time you do it, you're not going to be at your maximum efficiency. So everything we do, we want to do it in a small scale first, learn from it. Our mantra is we have to try things out and get good before we can go fast. And we want to be in a place that when we get a robust vaccine supply, that we can go fast right away, because we want to get as much vaccine into people's arms as quickly as possible.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Hi there, Premier. I'm wondering if you could tell us about what led you to choose March 9 for the House sitting dates.
As you would have seen over the last number of weeks, really months, a number of cabinet ministers have also decided that they will not be reoffering in the upcoming election campaign. I wanted to make sure that the new premier had a period of time to be able to appoint their own cabinet, considering the fact that a number of my colleagues, since I announced, have indicated they're not offering. So I wanted to ensure that they had a bit more time, and in consultation with them, I asked the Lieutenant Governor to hold off to the 9th.
Go ahead with your follow-up, Lindsay.
Thank you. March 9th, a little over a month away. I'm wondering if this is enough time for the candidates and for their plans to potentially form a transition team, name a cabinet, and be prepared with the throne speech for whoever is successful. Is this about a month period enough time for that?
There is always ongoing work that is happening. We have legislation that they can have a look at, but there's transitioning work happening with each camp, I'm assuming, already. They would be identifying people who could be sitting on that. I know when I experienced this back in 2013, I'd put in place a transition team before Election Day. I'm sure they will have people in their mind who they will go to. And we were sworn in roughly 2 weeks later. When I look back historically, it takes 10 to 14 days typically when governments are sworn in. So during that period of time, the transition team will be able to get started really on day one. They'll be able to put them together. And I felt in conjunction with them that the 9th would be enough time for them to be able to bring in a speech from the throne.
Next question will go to Danielle Edwards with the Canadian Press.
Hi. I had a question about the vaccine rollout will look out for people in Nova Scotia who perhaps aren't permanent residents here, including students and people who recently moved here.
They're part of our community. We've clarified in a number of places already that anybody who's living here, even if they're a student temporarily, they're eligible for vaccination. We're working at ways. Our main way we're going to identify people and get them is through MSI, but not everybody has an MSI card, so we're looking for different ways. But if they're here even as a temporary student, they are at risk like everybody else in the province. So we need to make sure they are protected as part of our collective safety.
Go ahead with your follow-up, Danielle.
And I also wanted to ask a little bit about the status of the Atlantic bubble. I know that in the past few months things have definitely shifted. Is there any discussion on rebuilding the bubble to its former status?
There's been no discussion at our level. I think all of us are watching and praying that our Atlantic Canadian friends in New Brunswick and Premier Higgs and his team get some relief from the number of COVID cases they've been experiencing. And that's really been our focus, and to make sure that if there's anything we can do, that but the restrictions with New Brunswick will stay in place until at least for some time. I think all of us will need to see those numbers come down, and the news yesterday or today with the 3 different variants that had arrived into New Brunswick obviously are worrying. But you know, as soon as we can, we'll do that. But we'll always put public health first, even though that has the Atlantic bubble was such a huge success, and I think people felt pride in it. We will hold the public health restrictions that are in place and the travel restrictions until further notice.
Next question will go to Heloise with Radio Canada.
Hi, yes. I wanted to hear you, Premier, on the impact of the federal quarantine for travelers entering Canada. So they'll have to isolate 3 days in a hotel before coming to Nova Scotia. Will their quarantine be shortened once they enter? Or are they still going to have to isolate 14 days here after isolating elsewhere?
I will let Dr. Strang answer that. I'll see if he gets it right.
So these individuals are mandated for a 14-day quarantine under the Federal Quarantine Act. It's simply that their first 3 days, while they're waiting for their test result, of the first 3 days of their 14 days, it has to be in the city in a hotel where they arrived. If they're negative, they get to move on, but they still have to complete another 11 days of their quarantine once they get here. So some of our questions, and this is no different when we've had international travelers all along for their international federally mandated quarantine. They're under federal authority, and we continue to work with our federal colleagues. We have some questions now that we're waiting to get answers on about. They have indicated that they're going to increase their oversight and their compliance under the federal mandate, and I'm certainly waiting to hear the details on how they're going to increase that, and what if anything we may need to be doing here from a provincial perspective to support that federal 14-day quarantine.
Go ahead with your follow-up, Heloise.
Thank you. So I was just wondering if you could tell me if every COVID test result is being checked for the strain, or what are for the variant, or what criteria do you use to determine which test will be sent to Winnipeg to check for the variant?
So we have a number of criteria. The first one is anybody who's a traveler, and so since all our low number of cases are travelers, in essence, right now all our cases are being sent off for the genotyping. We also have criteria that if we had more cases and we were seeing cases that we were concerned, really very short incubation period, so a very short period of time between when somebody was exposed and they became sick, or if we were seeing an unusually high number of contacts of cases who were the contacts were testing positive. We've already talked about how we would then flag those cases for the lab and ask for those to be sent on. My team is having discussions this week about how we may even further enhance how we use testing and which tests we would send off for the sequencing through the lab to the national lab. We are also having some conversations, very preliminary, about how we might build our own capacity here to do this whole gene sequencing here right in Halifax and not have to send them off, because the national lab is in a significant pressure with dealing with all the demands, and the federal government's very interested in how other labs may be able to do some of this testing.
Next question will go to Jesse Thomas with Global.
Thank you. This question is just regarding the vaccine rollout. I think a lot of people look at the COVID dashboard and see zero doses received last week. There's a bit of anxiety around, the unpredictable supply chain, I guess, as you say. And I'm just wondering, as we're expecting to see almost 40,000 doses come in February, the majority from Pfizer, and we're seeing, issues over there in Europe. I'm just wondering, during phase one, with this supply issue right now, how it's affecting the province's timeline in administering the vaccine.
So everything we're hearing is that even though we've got short-term slowdowns, both from Pfizer and now Moderna, where we're being told that we will the gap, what we didn't get right now, will be made up in February and March, and then we're still on target in our in the first 90 days to get the amount of vaccine that we're expecting. Some of it is just going to come a little bit later, but that is why from the very beginning we've built a flexible delivery model that we can speed up or slow down very quickly depending on the vaccine supply. So when we get more vaccine in February and March, we can make sure that we're able to deliver that vaccine in a very timely manner.
Go ahead with your follow-up, Jesse.
Thank you. With the COVID-19 variant, really being a concern just for its infectious rates, and we're seeing it in our sister province in New Brunswick now. I'm just wondering, are we looking at increasing any restrictions right now with other provinces or people coming in from other provinces to Nova Scotia? I do see even in Alberta they're looking at adjusting their quarantine time for people that test positive for one of the variants as well, to extend it beyond the 14 days. I'm just wondering if you're looking at things like that, or where we're going with that variant.
So I'll speak to the Alberta situation. If you actually read the interview, we're already doing that in Nova Scotia. They're not extending. It was reported that the quarantine could be up to 24 days, which is true. But what it means is that if there's somebody in a household who's the first case, those other household members, they now have to quarantine because the first person will be considered resolved, up to at least 10 days. So once the first case in the household is considered resolved, the rest of the household has to then start a 14-day quarantine period. That's all. It's a bit technical, but we have been doing that for a period of time already with our cases, whether they're variants or not. So it's not everybody has to do a 24-day quarantine period. It's under specific circumstances of household context. In general, we know that how the variants are controlled is by all the measures we have in place. Careful restrictions at the border. We are doing that. We're looking, as I said, how we may perhaps increase the frequency of testing for people who are coming into the province to make sure we are even more vigilantly looking for COVID and looking for variant strains. But all the other measures in place, adhering to quarantine, social distancing, wearing masks, all those other pieces, that prevents the spread of COVID virus no matter what variant it is.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, good afternoon. Premier, this week your government announced, I think to no one's surprise, that the ferry service to Yarmouth would be canceled and because of the continuing COVID emergency. I would imagine that there's a range of considerations in that, including the length of the season, the cost. I wonder, though, if you've done any, if your government has done any modeling or has any expectations on the recovery of the overall tourism industry, not specific to the ferry. Can you give tourism operators some indication of what they might be able to expect this coming summer?
Well, I think there's a lot of unknowns for all of us. One of your colleagues asked a question about the Atlantic bubble. We know that when that was in place, Atlantic Canadians stayed home, went and visited each other's provinces, saw the beauty of this part of Canada. We won't know whether or not we will be able to reinstate that in time for tourism season until we see what happens. The amount of vaccine that arrives will determine how quickly we get it, will determine the decisions that they will make. So I know the minister and his team will be working with sector representatives to help us move forward. But we will continue to follow, our number one focus, quite frankly, will continue to make sure that we deal with this virus, and public health will be a major part of that. But we're well aware of the impact this is having on the tourism sector. So There's a lot of unknowns, and when we know it, we'll communicate it out to the industry and to all Nova Scotians if there's any restrictions being lifted.
I add to that. So I've had a couple of conversations. I was on one earlier today with the Labor and Economic Council, with business and other folks from across the province. I was asked a similar question, and the answer I've given several times to different business group is that you should anticipate all of us having to have some level of COVID protocols and COVID restrictions until we get into the fall. That's a fairly conservative assumption, but you should build your thinking on that. And certainly from the tourism sector, I said, we're going to have to remain very careful about people coming from other parts of the country, let alone internationally, for the next number of months. So I think, if people are interested in tourism, I'm going to put a plug in for, we're very safe in Nova Scotia. Let's, following all the public health protocols, there's nothing wrong with, spending your tourist dollars right here in Nova Scotia, supporting local tourism and other local businesses.
Go ahead with your follow-up, Tim.
Yeah, I had a different question, but given that response, Dr. Strang, and thank you for that, I know it's early days yet, and we don't know what the vaccine numbers are going to look like yet, beyond ballpark. But are you thinking about, or is there some sort of planning for potential something along the lines of vaccination passports for tourists coming into Nova Scotia?
So I think we're not there yet nationally. There's a number of ethical and other issues around vaccine passports, but even right now, the science behind them, until we get clear evidence that if you have 2 doses of vaccine that you cannot spread the virus asymptomatically, until we can answer that question satisfactorily, even if you have 2 doses of vaccines, you're going to have to follow all the public health protocols, including the quarantine. We'll get that answer. What the answer is going to be, I don't know, and the time frame, it'll be in the next weeks to months. But until there, we need to understand that vaccines don't solve everything. They're not a panacea. They're another important part of our overall approach to COVID. But I think that the key message I'll come back to is we have to be prepared to live with our own personal and family COVID protocols, with our workplace COVID protocols, and some level of necessary public health restrictions, at least for the spring and the summer. And so we should think about having to do that into the fall. That, I think, is a fairly safe place to be. And if actually it turns out we can be a little bit faster than that, then that'll be great news. But I think to have some reasonable expectations that COVID is not going away anytime soon, even as we add vaccine to our toolbox to deal with COVID.
Next question will go to Victoria Whalen with the Coast.
Thanks. I'm wondering, Dr. Strang, if we'll be looking at any point at reporting race-based data here in the province. Some provinces have reported it for COVID cases, like Ontario, Manitoba, finding marginalized communities are more likely to experience adverse outcomes if they catch COVID. And just wondering if that's a discussion that we're having here in the province now or in the future.
We're involved in, we are having that conversation. I haven't personally had an update on it recently. The challenge is right now our numbers are so low that we have to be extremely careful about how we report any details of any case, because the numbers are so low, then there's a real risk of disclosing somebody's personal identity through that. But those are ongoing conversations we're having here, and we're involved in some national discussions around that as well.
Go ahead with your follow-up, Victoria.
Thanks. And similarly, we said we're in consultation with African Nova Scotian and Indigenous and First Nations communities. I was wondering if you could give any of the groups that we've been working with, that the province has been in communication with, about how those community clinics in those communities might roll out.
So we're working directly through the First Nations chiefs and their health directors in our 13 First Nations communities. We're in direct discussions with them. I have, ADM Barbrick is communicating with them on an ongoing basis. I have calls every 2 weeks with the 13 First Nations chiefs. With the African Nova Scotian communities, we're working mostly through the Health Association of African Nova Scotians and their connections, as well as how we work with them to identify opportunities for community clinics.
Next question will go to Pat Healy with the Laker.
Thank you. I'd like to ask Dr. Strang, there's talk of a provincial junior hockey league possibly shutting down if fans are not allowed after this week. Is there any anticipation in allowing fans into hockey games or any sporting event in the next week or two?
So thanks for the question, Pat. That is part of the conversations that we're looking at in terms of gatherings in general, and we'll be having decisions and announcing those on Friday.
Go ahead with your follow-up, Pat.
All right. We're in February now, and prom and graduations are coming up in 3 or 4 months. With COVID-19 still prevalent and the vaccine rolling out, what type of proms and graduations should Nova Scotia high school graduates expect to see this year?
So I wish I had a bit of a crystal ball. I really can't think more than 2 or 3 months ahead of time at the max. So I hope, Pat, that we're able to have more in-person proms than we did last year, but it's premature to speculate where we might be. And I know, and I say this all the time, I fully appreciate people need lots of time to plan, but being in a pandemic doesn't necessarily give us that luxury. So we'll move forward, and we'll have to watch our epidemiology for this, as well as a large range of other issues as we come from the spring and into summer.
Next question will go to Jean Laroche with CBC.
Good afternoon, Dr. Strang. I just wondered, I want you to explore something that you've talked about during this briefing a little deeper. You have said repeatedly, and again today, that the age-based kind of queue system for vaccination is the best way to go, but it would seem to be intuitive that, and you mentioned truckers who might bring it into the province should move further up the queue, that some professions, such as police officers who come into contact with a lot of people, it would seem to be intuitive that they may be better placed further up the queue than somebody simply based on their age. And can you square the circle for me? Tell me or explain the logic behind why it's better to do an age-based system, as the province has done, rather than target specific groups who might be more in contact with more people.
Thanks, John. And so we've looked at this, and there has been work going on that if we do have to, as we get into April and May, have to have very specific priority groups, we've got the work done, looking at what we call so-called essential workers. But the reality is, if we achieve a robust vaccine supply, doing age-based accommodates by far the biggest risk factor, and gets people based on age, as quickly as possible. Many of the other workplaces, as I said, vaccine doesn't solve everything. They have existing COVID protection protocols involving personal protective equipment, other types of protocols, which are a layer of safety already that they have. The third piece is as we work through the logistics of this, and the vaccine planning team has looked at this extensively, every time we take a defined group and we have to divide our energy and our efforts around vaccination in multiple different directions, and we have to have registration and validation that you're in the group, all those things, that actually substantively slows us down. So again, if we come back to if our overall goal is the population gets immunized as quickly as possible, then the best approach to take to reach that goal is to stay focused as much as possible on age. Everybody will get a chance, as their age comes up, and it will protect people as they get the age cohort. But it's some of it is about, as I said in my remarks, we want to have those who are at greatest risk from severe disease getting immunized first, and have a process that moves us as quickly as possible through everybody else. So some of this is about putting our own interests behind the interests of the entire community and the population.
Go ahead with your follow-up, Sean.
Sure. On another topic, as you know, Dr. Strang, the federal government announced that we would have homegrown vaccine production in this country by the end of this year, maybe even early into next year. And I just wondered, in relation to this particular pandemic, what value is having homegrown vaccines available in about a year's time?
So we don't know where we're going to end up long term around COVID. There may well be a need for ongoing immunization of some individuals or at some frequency. I'm not going to say it's going to be annual like flu vaccine. We just don't know. Developing our, I'm going to use a better term than homegrown, Jean. I'm going to call it our domestic supply of vaccine is a long-term benefit because we don't know how long we're going to need a COVID vaccine. But I've been around long enough that this discussion involves our childhood vaccines, MMR vaccine, pertussis vaccine, that relying on offshore availability of vaccine entirely always makes us vulnerable for any type of vaccine program. So having it, I'm fully supportive of redeveloping a domestic vaccine production capacity in this country.
That's all the time we have for questions today.
Thank you, Chrissy. There's been a lot of talk out there about restrictions, and I want to assure you there's been a lot of chat in here as well. These are very difficult decisions because lifting any restrictions, even when the numbers are down, makes us vulnerable and puts us at risk. I know you want to watch your kids play sports, you want to see your kids gather at clubs, and lots want to go to a bar to watch the Super Bowl. But each of these activities, while they may be fun, could be breeding grounds for COVID. Any changes to restrictions will not come into effect until next week. As I was asking one of the questions about the Super Bowl, I wanted to let restaurant and bar owners know hours currently in place will remain the same, even though it is Super Bowl weekend. We want you to be able to enjoy yourselves and celebrate the success of keeping COVID numbers down, but we also need to be very careful about opening up. We do not want to put ourselves in a position of shutting down again. We've worked too hard to stay open. So by Friday, we will be able to talk about the restrictions we are lifting next week. I hope Dr. Strang and I have your understanding. Every decision we make is about protecting you. And even if you don't always like the decisions we make, we want you to know we make those decisions thinking about your health. We will talk more about these on Friday.